Avoid oranges if you have these health problems. 1. Acid reflux and GERD. Sarah, a 35-year-old accountant who loves her morning glass of orange juice. Recently, she started experiencing frequent heartburn, especially after breakfast. After consulting her doctor and keeping a food diary, she discovered that her favorite orange juice was triggering her acid reflux symptoms. Once she switched to less acidic fruits, her symptoms dramatically improved. A study published in the journal Gastroenterology found that acidic foods, including citrus fruits like oranges, can lower the pH of the stomach, thereby triggering reflux in susceptible individuals. The study highlights the importance of dietary modification in managing GERD. Oranges are naturally high in citric acid, which can aggravate acid reflux or GERD, gastroesophageal reflux disease. If you have ever experienced heartburn, you know how uncomfortable it can be, and oranges could be making it worse. If you want to consume orange, limit the quantity of oranges and avoid consuming them on an empty stomach. Some orange varieties, such as mandarin oranges, are slightly less acidic. Opting for these might help reduce symptoms. Combine oranges with foods that are more alkaline, like leafy greens or nuts, to help neutralize the acidity. Orange juice is highly acidic and can exacerbate reflux. Stick to whole fruits in small portions. Keep a food diary to track how oranges affect your symptoms. If you notice that even small amounts trigger reflux, it might be best to avoid them entirely. 2. Kidney stones. John, a 50-year-old man, had a history of kidney stones. Despite maintaining a generally healthy diet, he frequently consumed oranges and orange juice, believing them to be harmless. After a painful episode of kidney stones, his doctor advised him to cut down on foods high in oxalates, including oranges. After making dietary changes, John noticed a significant decrease in kidney stone recurrences. According to a study published in the Clinical Journal of the American Society of Nephrology, high oxalate intake is a risk factor for the development of calcium oxalate stones, the most common type of kidney stones. The research suggests limiting foods like oranges in individuals prone to kidney stones. Oranges are rich in oxalates, which can contribute to the formation of kidney stones, especially in individuals who are prone to them. If you still want to consume orange, limit the number of oranges you eat, focusing on moderate portions to keep oxalate levels low. Drink plenty of water throughout the day to help flush out oxalates and reduce the risk of stone formation. Consuming oranges alongside calcium-rich foods like low-fat yogurt or cheese can help bind oxalates in the digestive tract and reduce their absorption. Regularly consult with a healthcare provider to monitor your kidney health and adjust your diet accordingly, especially if you have a history of kidney stones. 3. Allergic reactions and oral allergy syndrome. Emma, a 28-year-old teacher, loved snacking on oranges during her lunch breaks. However, she often noticed a tingling sensation and mild swelling in her mouth after eating them. Her allergist diagnosed her with oral allergy syndrome, linked to her existing birch pollen allergy. Emma was advised to avoid raw oranges and found that cooking or processing them reduced her symptoms. Research published in the Journal of Allergy and Clinical Immunology indicates that individuals with OAS, particularly those allergic to birch or grass pollen, may react to oranges due to cross-reactivity between pollen and fruit proteins. The study emphasizes the need for awareness of food allergies and their management. Oranges can trigger allergic reactions in some people, particularly those with oral allergy syndrome, OAS. This condition occurs when the immune system confuses proteins in certain fruits with pollen, causing itching or swelling in the mouth and throat. If you still want to consume orange, cook or process oranges can help denature the proteins that trigger allergic reactions. Try consuming them in cooked dishes or as part of jams and marmalades. Avoid raw oranges if it triggers symptoms, and opt for processed forms that are less likely to cause a reaction. Some people with OAS might tolerate other citrus fruits like grapefruits or limes better, so experiment with caution. Always carry an antihistamine if you have OAS, and consult with an allergist for personalized advice. 4. Diabetes and blood sugar spikes. Paul, a 60-year-old retired engineer with type 2 diabetes, often included oranges in his diet, believing them to be a healthy snack. However, his blood sugar levels remained unstable. After consulting with his dietitian, he learned that whole oranges, and especially orange juice, were contributing to his blood sugar spikes. By switching to lower glycemic fruits and managing portion sizes, Paul was able to better control his blood glucose levels. A study in the American Journal of Clinical Nutrition found that while whole fruits are generally beneficial, fruit juices, including orange juice, are linked with an increased risk of type 2 diabetes due to their high glycemic load and the rapid absorption of sugars. This underscores the need for portion control and monitoring of blood sugar levels in diabetic patients. Oranges, despite their health benefits, contain natural sugars that can cause blood sugar spikes, particularly when consumed in large quantities or in juice form. This can be problematic for individuals with diabetes or those struggling with blood sugar management. If you still want to consume orange, choose whole oranges over juice. Whole oranges have more fiber, which slows the absorption of sugars and helps prevent blood sugar spikes. Stick to one small orange per serving and avoid eating them frequently. Combining oranges with protein, like nuts or a piece of cheese, or healthy fats, like avocado, can help balance blood sugar levels. Monitor your blood sugar after consuming oranges to see how they affect you and adjust portions accordingly. Include oranges in a balanced diet that emphasizes low glycemic foods to help maintain steady blood sugar levels. 5. High blood pressure and medications interactions. Lisa, a 55-year-old nurse, was on medication for high blood pressure. She regularly drank orange juice for breakfast, thinking it would help her heart health. However, she started experiencing symptoms of hyperkalemia, including muscle weakness and irregular heartbeats. Her doctor advised her to limit high-potassium foods, including oranges, which helped stabilize her potassium levels. Research published in the British Medical Journal highlights that high potassium intake can be dangerous for patients on certain medications that affect potassium levels. The study recommends that individuals on such medications should consult healthcare providers about their dietary potassium intake, including from fruits like oranges. Oranges, especially their juice, are high in potassium. While potassium is generally good for heart health, it can interact negatively with certain blood pressure medications, like ACE inhibitors and potassium-sparing diuretics. If you still want to consume orange, consult with your doctor or a dietitian to determine how much potassium is safe for you. Reduce the frequency and portion size of oranges to control potassium intake. Pair oranges with foods low in potassium to keep your overall intake within a safe range. Orange juice is concentrated and contains more potassium than whole oranges, so it's best avoided if you have potassium sensitivity. Regularly check your blood potassium levels if you're on medication, and adjust your diet based on medical advice. 6. Migraine triggers. Maria, a 40-year-old graphic designer, suffered from frequent migraines. She kept a detailed food and symptom diary and noticed a pattern between her migraine attacks and the days she consumed oranges or orange juice. After eliminating citrus fruits from her diet, her migraine frequency reduced significantly. A study from the International Journal of Neuroscience found that citrus fruits can trigger migraines in susceptible individuals due to the presence of tyramine and other vasoactive compounds. This suggests that dietary modifications could play a role in migraine management for some patients. For some people, citrus fruits, including oranges, can trigger migraines. The exact cause isn't fully understood, but it's believed that compounds in citrus fruits might influence migraine pathways in the brain. If you still want to consume orange, try consuming a very small amount of oranges to test if they trigger migraines. If they do, it's best to avoid them. If oranges are not a strong trigger, consume them in small portions, spaced out to avoid overloading potential triggers. Avoid consuming oranges on days when you're already experiencing other migraine triggers like stress or lack of sleep. If oranges are a confirmed trigger, look for other sources of vitamin C, like bell peppers or strawberries, which might be less likely to cause migraines. Keep a migraine diary to identify specific triggers and patterns, and adjust your diet to minimize potential triggers. Oranges are not always the best choice for everyone. If you have any of these conditions, consider discussing your diet with a healthcare professional to make sure your fruit choices are helping, not harming your health. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. See you in the next video.